Hello and good evening to all who have joined for the session. Good evening, Parul ma'am. So today we are beginning with our series of learning about nutrition with Parul ma'am, and it is actually a most awaited session for many of us, and we are eagerly waiting to hear you, ma'am. So, I'll introduce you first. I'll take a few moments to introduce our speaker. Ms. Parul Malhotra Behel. She's the founder of Diet Expression. She's a clinical nutritionist and a certified diabetes educator with an experience of over 12 years in the health industry. She has done her postgraduate diploma in dietetics and public health nutrition, followed by master's degree in nutrition, physical activity, and public health from Bristol University, UK. She has worked with renowned hospitals like Sri Gangaram Hospital, Sitaram Bharatiya Institute of Science and Research, Medanta, the Medicity, and few all other large organizations. Today, she's here with us all to share her practical approach and important pointers that need to be kept in mind while practicing nutrition in the real world. Ma'am, we are really eagerly waiting to hear you and very excited for the session. Looking forward to your sharing of knowledge. This platform is all yours. Welcome, ma'am.
Thank you so much, Ritu. Can you just let me know if I'm audible and you can hear me pretty well?
Yes, ma'am, you are very clear.
All right, great. All right. So, hi, everybody. And thank you, Ritu, for such a warm welcome. And really appreciate that you guys wanted to hear me out and understand and, listen to my experience. It is quite a cherished experience that I have had. So I'm very glad and pretty excited to share it with all of you because you're all young budding students who would get out into the world and you would be dealing with all these that I've already dealt with all these years, and I'm still learning, guys. Right? So there's no stopping to learning. I'm still learning and I'm still growing. So welcome to the world, right? So okay, I'll start. And I'm going to share my screen with you all, and I'm going to be sharing a little presentation. So my entire discussion would be very practical, guys. So I'm not going to be teaching you anything specific to nutrition, like the ABC of nutrition. You have that course under you. You have learned how to prepare and build therapeutic diets. You are pretty well aware of that, right? So me teaching you that doesn't make any sense. But in the real world, what is very critical is what I'm going to put across to you, which, if any of you are going to take that path of becoming a nutrition counselor, or because I understand you guys are more over and going to become naturopaths, right? And you have learned yoga, you've been learning so many other things which is related to health industry. So once you are out there, you would be choosing your path. Many would become yoga instructors, many would become whatsoever. And I have had friends who are now nutritionists and they are naturopaths, right? So let me get started without delaying any further. So I'll share my screen. Are you able to see my screen, Ritu?
Yes, ma'am. Yes.
All right, great. I'll just begin the presentation.
Hello. Hello.
Thank you. Thank you for going on mute. All right, guys. So I'll just get started. So basically, the topic that I've taken for you guys and is art of nutrition practice, a practical approach. As I said, I'm going to be putting across my personal experience of all these 12 years that I've had, and the learnings that I've had through this experience is what I'm going to put across to you. So it is not going to be very theoretical. It'll be very practical. right? And I really, really hope it helps you. So in the end, I will have a little phase, a little time left for some practical questions. So if you have any questions, please feel free to ask me by the end of it. Okay, so let's begin. So my journey so far, I started with hospital IBDs, OPDs, just like any other dietitian or a nutritionist would go through. So I have worked in IBDs, but I gradually understood that okay, IBD is not where I really want to stick to. But I learned there. There it was a very few phase where it was a very small phase where I was in the IPD, and I understood okay, hospital scenario in the inpatient service is not where exactly where I am really interested in. Gradually, I shifted to the OPD sector where I was more interested in counseling. I was more interested in meeting people face to face and helping them really understand the whole concept, help them bring a change in their lives. In hospital, in the IPD bed, it doesn't really matter what exactly you want to tell them, because you're more inclined, or you're there more into the kitchen and making sure that whatever food is going into the hospital, into the inpatient people is correct and well, is as per the therapeutic condition. But when it comes to OPD, it is a lot different. And if anybody of you who would be actually doing all that, you would get to experience that. So 7 years I was pretty much into that environment, where I was more into OPD sector, where I was out seeing the outpatients. I was associated with endocrinologists because as I also started my career being a certified diabetes educator. So I was into that sector, and I have had a privilege of working with really well-known endocrinologists in the country, and I worked with them, understood how what these people with diabetes, what they face, what they go through, what are their psychological sufferings, and what is it exactly that stops them from actually becoming healthy and being able to do what we ask them to do, right? So that's what I'm going to really share with you and help you learn that what you can do when you become a counselor, or you become a nutritionist, or you become even I would say a health coach, because at the end of the day you would become that only. So 7 years into hospital IPD and OPD, so my experience really comes from there. And then pretty good 4 years of experience, I transferred from it was a huge transition from a face-to-face conversation or face-to-face dealing with patients. I had this transition into an online healthcare system, where I actually started working in a company where I was actually dealing with people, with patients, or with clients. I would say there was a huge transition of me learning that actually I'm not dealing with patients, it's actually clients or it's customers. So there was this transition, and I learned how to deal with that, where I was not only dealing with people who had therapeutic conditions, but who really just wanted to lose weight, and they had just cosmetic issues and they want to get rid of that. So a lot of change or shift that I got to know in these next 4 years, there where when I was working in an online healthcare, that how different it is when as a counselor you dealt with people face, and actually you ended up dealing with people online. We are not even looking at them. It was a big challenge, believe me, because making people, it's a big challenge to make people do what you want them to do face to face. Imagine what a challenge you face when you are actually not even seeing them, right? So that was a big challenge that I had to really get across. Then finally, the last 1 year, I have been freelancing. So I have my own company, which you already know. So it took me all these years to actually get this entire, you know, confidence built in myself that, okay, yes, I've had this varied experience of dealing with so many different people, so many different scenarios. And okay, and 1 year back is when I really thought that, okay, I think now I'm ready and I can take it on my own and I can deal with people on my own. I have that entire mindset up. I've learned enough. I've got those experiences with which I can now face the entire challenge myself, and I don't need any extra support system. So why I have told you this, my journey, because guys, many of you might have a similar journey, or maybe somebody would straight away start with freelancing. So it would be a good learning for you, because I'm going to step by step put across all these things that I've learned in these 12 years and put across to you. So coming down to what I really want to share with you all. So this is something very basic. Everybody of you know nutrition. You know it. It's a study of nutrients in food, how the body uses nutrients, and the relationship between diet, health, and diseases. That's what we have learned, right? That's the fact. That's something which you have established in your heads, that this is what nutrition is, and you are knowledgeable about it now. Now, as a dietitian or as a nutritionist, what do you do actually? So you interpret and you communicate all the science of nutrition so that people can make practical choices about food and lifestyle in both health and diseases. So you basically enable them, empower them. You, in today's world, or in my experience, what I've seen is that somewhere down the line, we as coaches or we as nutritionists, we forget that we are the channel. We are the ones who are going to empower them. We are nobody to impose on them. We start imposing ourselves, we start imposing our knowledge on them, which is going to be a big failure as a coach or as a health consultant. You have to remember this all the way through, that you are the mediator. You are a person who is interpreting something which is science, which you're interpreting a science, and you are actually communicating it out to the world so that they can really understand what that science is saying, and how they can actually practically use it in their daily life. So this is very critical that you remember, which due course of time we tend to forget. I have seen that happening. So what are there certain pragmatic issues, or I would say some really challenges that we don't think about and we face. So many of us, when we learn, as practically when we sit and make diet plans in theories or in classes, what we learn to, calculate the calories, to calculate all the nutrient requirements. And then, okay, in examinations, we get this case study and we know, okay, this is the situation and this is how we have to make the plan. And when we jump out into the real scenario or in the real world, and we actually have a client in front of us or a patient in front of us, what happens? We end up just understanding, on knowing, okay, this is the height, weight, this is the calculations. We make the diet plan. Is that sufficient? We make that and we hand it over. Is that sufficient? Remember, guys, that will never be sufficient. That is just one tiny little part of you as nutritionists or as somebody who makes a diet plan for somebody. So even the best calculated or the well calculated diet plan will never be enough. That's one challenge that you have to, that each dietitian or nutritionist faces. Those struggle who stick to this point, who just make a diet plan and believe, okay, 1500 calories, this is your diet chart, here you go, get started. It's never going to work. You will doom, you will fail very badly, because there will be no adherence. Patients will not listen, patients will not follow. Coming to exactly what I just said, the second pointer, which is again a big challenge, ensuring adherence to the diet plan. That is a very critical point where practically we face issues. We know how to make a diet plan, but most of us, we really face a challenge, that how do we really make our clients or patients adhere to that? There will never be 100% adherence, guys. Always remember, nobody will be able to follow you 100%. They will always have some or the other reason or some challenge or some barrier because of which they would not be able to follow you 100%. But if they have followed you even 80% to 90%, believe me, it's a victory. It is a big victory for you. And it's just not in the diet aspect, believe me. Even if you become a yoga instructor or you become any other person, any other health instructor, even so, if your clients or your patients follow you even 80 to 90%, guys, you're hitting the line, right? And third, very critical, a successful nutrition care process is essential to achieve the end results. So even if you make a good diet plan, if you're not able to make your patients or your clients adhere to it through a proper nutrition care process, everything that you do on the paper is absolutely zero. So practically, You need to learn, you need to develop certain skills, certain things in you with which you can actually make your patients adhere to what you want them to follow. So these are the some pragmatic issues which you need to keep in mind before you enter the real world. So, what do we do about them? So, what is this nutrition care process that I'm talking about? It's a very simple process. It's a four-step process. I'm sure somewhere in your theory, you must have gone through these 4 pointers. This is where we start our nutrition learning, our diet learning. The nutrition assessment, the nutrition diagnosis, and the nutrition intervention, which is your plan of action, and then your nutrition monitoring and evaluation. This is what the process you need to follow. That's very theoretical, which we have learned, which we know. Okay, we have to first assess, we have to take the diet history, we have to take the height and measurements, take all the blood test reports, all blah, blah, blah. We know that theory. What is the practical problem? Let me come to that. Practical issues are here. When it comes to nutrition assessment, point number one, when you're sitting with your client face to face, what is the first thing? We just start asking questions. We just start taking, there's a questionnaire in front of us. We are sitting and, okay, this, please tell this, please. We end up becoming a robot. And believe me, this happens. Maybe as a student, you don't realize it right now, because right now, each and every step is like a process for you, and you need to take it literally like a process. But when you enter the real world, when you get into a larger organization where you will be ending up seeing 10 patients a day, maybe 20 patients a day, that's when you have a limited time period, you have 20 minutes to see a patient or 20 minutes to see a client. What happens when you have that little 5 to 10 minutes of assessment period? It becomes very, very critical for you that you remember these practical aspects or these practical pointers. Develop trust, rapport building. Do not skip this point. This is where you build that connect, you build that trust. Talk to them. Never just start away, okay, I'm your nutritionist, so let's get started. No. Where you need to start in the beginning is, yes, give them some support, give them some trust. Tell them, I'm here to help you. Okay, I'm here to help you achieve what you're looking out for. Whatever condition it is, whether it is a therapeutic condition, whether it is just a normal health condition. Health condition, by I mean, many people just want to lose weight, or many people just want to become healthy, they want to become fit. So we don't consider that a typically a therapeutic condition. So even if somebody is having diabetes, wants to balance their sugars, right? So develop a trust. Talk to them nicely in the beginning. Create that bond with them. Believe me, guys, you don't need a half an hour session for that. You need just that initial 2 to 3 minutes or 5 minutes where you can actually build that connect. The way you talk, the way you reach out to them, put a smile on your face. Don't let your anything somebody has said outside, you had a bad argument, your boss said something, your senior said something. Many times we go sit in the counseling and that's running in the head and we have a frown on our face. Remember, who comes to you wants to see a smile. That's the biggest support or a trust you can give to your clients, that I'm there happily sitting to help you. That's a very critical and a very practical thing I'm giving you guys. This no book will tell you. No book will tell you, but this is my own learning. And you would say, ma'am, what is so different about it? What is so new about it? Okay, we know that. But believe me, guys, the days I've had a little frown here on my head and I have gone for a consultation, and the days I've had this beautiful smile on the face and gone and did my consultation, it was a huge difference. Not on my counseling session, the difference was on the client. The next time when I had a follow up with the client, both clients had a very different outcome. The client, and you can actually understand what the difference would have been. The person who could not relate to me because of the frown on my face, the client didn't understand anything. So when you start, if you want your client to understand, listen to you, please connect. Please develop that trust. Keep that smile on your face. Second, history taking. That's what we have been told, right? You have to sit, you have to take that 24-hour recall or various other documents which you would have to take that details from the client, right? Now, that's where it is very important. Once you've developed that trust, the client will open up a little bit with you. Client would want to share things with you. Otherwise, you would see there are so many different people out there, guys. Some people themselves want to, they're, all the way, they're like actually extrovert, and they would come out and then tell everything they want to tell you. But there will be many introvert people as well who would really take some time to open up and tell what's bothering them, or what problems they are facing. And until unless you pull that out from that person, you will not be able to design the perfect diet for that person. So probing is essential with a personal and softer touch. Remember that, guys. Please take these pointers very, very critically. As a counselor, you will be a success only if you remember these pointers. A good diet, any dietitian can make if she is intelligent enough. But a good diet counselor will be only the one who would take care of these pointers, because a diet will come across to your patient successfully only when you follow these, right? So, personal and softer touch. So, probing is essential. Don't stick to the typical end to end question. Don't stick to that. Go into a little detail of that question. If you think of if your patient is giving a yes no answer, because you are asking an open ended question and your client is, or your patient is giving a yes no answer, you can identify, okay, patient is not opening up. Be softer, be gentler, extend the question, probe further so that you get the desired answer. Don't just stop and just stick to the question which is there on the questionnaire. That will never end up giving you the real picture. So, very important. So, rapport building, developing a trust, then probing, very critical. Don't just become a robot. Stop, understand, be aware what the client is saying. Is he just responding to you like a robot, or is he actually doing a conversation, telling you something from deep within? Identify key risk and causative factors. The other two pointers are very, very theoretical, which you know that you have to identify the key risk factors. Very important. Go back to their medical history, go back to where their situation started. Many times it's not physical, it's many a times it is stress, many times it's psychological. Until and unless you probe, you will never understand, you will never get the right reason for the problem. So it is very critical. Obtain timely and appropriate data using appropriate tools and methods that you already know. That I'm sure you are very well equipped as of now. There is nothing very practical about it here. This is something which is very theoretical, and to actually build a good diet plan, we do need these things. So this is nutrition assessment. The very practical things which you need to always remember is developing a trust, creating that rapport, and then probing into the questions. That's very, very important. Coming to the next thing, which is the nutrition diagnosis. So how do you diagnose? You've taken the entire data, you've spoken to the client, but still, how would you really interpret? How would really you would really know what is the deeper cause, or what is the deeper problem, until unless you have a more wholer perspective or a wholer um, discussion with the clients. Why do people eat the way they do? It is very, very important for each one of you who would want to get into nutrition counseling to understand. We just don't want to know what is the nutritional status. That we have already done in the assessment. We'll know what they're eating, what kind of food they're eating, and we would know their schedule. We would know all that. But why is it that they are doing that particular thing? Or why do they eat that particular thing that you've seen in their recall? You need to diagnose that, you need to understand that. So this is the place where you identify barriers. That's very critical. And remember, guys, when you have that little time now, most of us, we skip this. We are not able to probe questions to identify barriers or identify problems. And that's where what happens is we make a very technical diet plan, and that's where everything goes off. The client or the patient doesn't connect with the diet plan. They say, oh, this is something I'll get on Google also. Why are you wasting your time on this? I have seen that happening many times. So how do you avoid that? Because nowadays, remember, guys, patients, clients, they're not stupid, they're not dumb. Google is has become a guru. You know that. People will sit on Google and they will know everything before you would even say something to them. So in this age, in this stage where people have a place where they know everything beforehand, it could be false, completely false. But you need to understand and deal with your patients and clients in a way that they don't overpower you. And how would that happen? Only when you develop a trust, and then when you identify the actual problems and barriers through probing and asking questions. Get into the deep roots. Eating food is just not a physiological response. And by now, if you've read nutrition, you know that. It's not just the physiological response. It's just not the hunger part which is responsible for somebody eating the way they eat. It could be social cultural reasons. It could be economical reasons. And I'm sure you understand what are these issues. It could be environmental. It could be geographical. As simple as that, somebody living in an international country, or in somebody living in Japan, or somebody living in a place where they are not having Indian foods readily available. So you have to understand. If a person will say, okay, I love Indian food, but I can't eat Indian food. If you restrict yourself over there, you would never be able to help them get a solution, because you don't really know what is the problem. You have to identify, okay, what are the things which are available around your geographical area? What are the things which are not available? And then you decide and create a diet plan for them. They will relate to your diet plan. They will eat what you give them, right? Individual choices, patterns, taste. You have to identify those. You have to ask these questions. And mostly, many questionnaires you will end up, they will not have such questions. They will not have questions related to these pointers. Maybe a small little question separately, okay, where you live or what you eat, but not in details. Get into that detail. Probe, open your horizons, and then ask. And the more you ask, the more you get out of your client, and the more your diet plan will be related to the diet, to the client. That is very critical. Health beliefs, attitudes, very very important. How much knowledge your client has, how much knowledge your patient have, identify that. Many of us, we just blah blah blah, we start telling them. If we get to know, okay, my patient sitting in front of me, okay, they have diabetes, has hypothyroid, has this, you will even before understanding whether your patient or your client knows about that condition or not, you will just start telling the theory. Don't do that. That is where I again go back to the basic. When you connect, ask these questions. Okay, so since how long you have had this condition? Okay, so what do you know about this condition? These questions, these kind of questions. Be humble, be softer, try and know what they know. Don't assume, never assume. Sit in front of them, ask as much as you can, because the more you will ask, they will really relate. They will know, okay, this person is asking me so much because the person is concerned. They want to know each and everything from me. And keep an eye contact. If it's a virtual thing, I understand we can't keep an eye contact, but you guys will start as in face to face consultations, so keep an eye contact. It's very very critical, right? So understand, what do they understand about their condition. If they already know about their condition, don't waste your time on, your time and their time and energy on just explaining blah 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 blah. They will be like, okay, why am I know already all this, why are you wasting your time? So today's world is like that. That's a practical challenge. That's a practical point which you need to keep in mind. So don't cut it, but put it across in a way that, okay, I know you already know this, but just to begin with, this is what this problem is, and understand to what level they know. If they know, okay, halfway, just complete the other half, which they don't know. So you have to be very, very aware, and your mind needs to be very very open when you're sitting and you're talking to your clients or your patients, so that you can actually give out what is needed and unnecessary talking is not happening, because that's where your client or your patient interest is gone, or their trust is gone, right? Coming to patient's level of motivation for change, very important. You need to understand whether your client is or your patient is even ready to change. Many people who will be diagnosed with somebody, and they have really high values of diabetes or high sugar levels, or they have high blood pressure, they will quite be motivated, and they would actually be very attentive because they're scared, right? But there will be some people who come to you and they just want to become healthy, they want to become fit, they don't have any scare with them, or they don't have anything. So understand why they have come to you. What is their goal? Is that goal really important to them? If that is really important to them, they will be very motivated. So you have to understand that what is the level of motivation that your client or your patient is at. So this is very important, because if they are not motivated, you might have to take certain steps where you actually bring them to that motivated level. Maybe their knowledge is not enough, maybe they are not really understanding the situations, the criticality of the situation. So maybe you have to make them aware of that. But be sensitive. So coming to the next, nutrition intervention. So after all this probing, after taking all this information from your clients, from your patients, once you have got that big, huge collection of information, your head has already planned an action. Your head, you have to be analytical. You have to be practical. You cannot be theoretical all the time. You know that in diabetes, okay, this is no, this is no, or this is yes, or this is yes. We know that theoretically. But when it comes to a practical diet planning, guys, when you actually set out and plan of action for somebody, you have to really be beyond that theory. And what do I mean by that? You have to see what are the problems, what are the barriers which are stopping them from actually getting to the right diet plan. Maybe a is a particular diet plan which your client or patient should follow. But maybe the client psychologically is not ready to follow that diet plan yet. Maybe he's not motivated, maybe he doesn't have the resources. It could be AYZ reason, which you will get to know when you probe the questions. But maybe you don't have to start with the plan A to begin with. Maybe you have to plan a diet plan B, which is a little less difficult, or maybe a little bit more, I would say, modified version, where you just start where the client is a little bit more comfortable starting with the diet plan, and then gradually you motivate your client, motivate your patient to come to the real diet plan or the actual diet plan. So that is very, very critical, guys. This is very important. Even when you start or you plan an action, remember your questions, your detailed information that you get, until unless you have that, until unless you probe more, you will not know. You really have to give that literally the calculated diet plan, or you have to modify the diet plan for the client and start with the modified version and gradually push the client to come to a proper diet plan. Just to give you a quick example here, like for example, when you deal with people who are into sports or who are into bodybuilding, right? So there would be people who are really want, now somebody who's in getting starting into bodybuilding would really need a lot of protein, would really need a lot of calories, right? But when you actually see what they're consuming, they're not even consuming half of what they're supposed to consume. Like somebody who needs almost 2000, 2500 calories is probably right now just consuming about 1400 calories or 1500 calories. So now for that person, if you will suddenly give a 2500 calories, he would go berserk. He would have no trust, zero trust on you. Now, though theoretically you have to give a 2500 kilocalorie diet plan to that person, but would he be able to actually follow that 2500? He won't be able to accept so many calories in one go. His digestion will go for a toss. He won't be able to take so much of protein immediately, right? So, what do you need to do in such scenario? You probe, you understand what is the present scenario and take one step forward. So maybe rather than giving a straight 2500, you begin with, if he's taking 1400, you step up to first 1600, right? You step up to first 1600 kilocalories. And then once the person has accepted that in the first 15 days, 20 days, you step up to maybe 1800 and you gradually pull that person to that. This was just one scenario, just to make it very simplified and easy to understand for you all. So this is what you need to keep in mind practically, guys. So theoretically, it's a number or it's a calculation, but practically, it's quite different. So I hope I have put my point very clear across to you guys. So coming to intervention, step by step approach, which I just told you, right? We have to overcome the barriers. So unless you've understand and identified barriers, you would never be able to take an approach to come over them, right? Now that's where your education and counseling will come. So diet plan is ready, okay, you've calculated, you've done that theoretical part, but what comes practically is how you actually put it across to your client. Just handing over that diet chart, telling them, okay, this is what you need to eat, this is the calories you need, this is the protein you need, they will not understand that. What they will understand it with, is it acceptable to them, is it practically doable for them? That's what you have to keep in mind, right? So customized plan, as each patient or client is unique, whether it is their acceptance, whether it is their body structure, whether it is their the place where they're living, whether it is their monetary condition, every client and patient is different. So you cannot have the same diet plan for one person. So that is very important. And how will that diet plan be different? Only when you do all these step by step, which I've just told you. So identify patients' level of knowledge and sensitivity, which I've already told you. So while counseling them, while educating them, if you're not ready and you don't know that how sensitive they are, maybe they're already so scared about their situation that if you're going to tell more scary things to them, they probably say, okay, 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 we don't want to listen to this. So you completely break their trust. Be cautious, be careful, be alert when you're talking to them. Don't put on a radio and just get started. That's what I mean. Educate to plan ahead. You have to tell them that they have to be ready, they have to pre-plan every step of their changing of habits. Now this is just one example. Set small and achievable goals is the second point in intervention. Keep very tiny targets, keep very small targets. Now just like this, one of my client, I had set just one small little target for her, which is just start portioning your meals. And this is what her response was after 10 days of her following the diet. She said, actually, before I was eating the same food, but what I was doing was I was having my tiffins or my carbohydrates more than my vegetables. After understanding you in the last 10 days, I've increased my vegetables, increased my curries, and I'm having less of rice. And she lost 1 kilo. And she sorry, in fact, actually, to be precise, 1.2 kilos. So it was just not about the kilos or the weight that she lost. It was about that she was enjoying her vegetables. She was eating the same food. She didn't have to change the food literally. All she did was she paid attention to the amount of food that she's having. And she thoroughly enjoyed. She was full. But what I did was I knew if I will completely change her diet plan, she will step back. I did gave her a very small, tiny goal. First goal, increase your water. And second, just watch on your portion sizes. Eat the way you are eating. So that little step is where the client will start getting happy. Oh, I did it, right? And then they will trust you for the next goal. So that's what you have to keep in mind. Set small and achievable goals. Then coming to nutrition monitoring, once you have set the intervention, once you have set the plan of action, now the real challenge comes. That is the adherence. Now it is very important that your patient, you know that you are being followed. How would you know? Especially in the virtual world, guys, it's very, very hard. In face to face, maybe when they come back for a follow up, they might bring a diary for you which they are actually filling up, but that also really depends on how honest they are. Same happens in their virtual world as well. But there's a little thing where I use this thing and it really helped, where I started taking their meal pictures. Now they can't lie with that, right? Okay, now if after that they added more and had and didn't tell me, that's a separate issue. But that much trust you have to keep in your clients. So now this, you have to gauge the honesty of your client. Now getting, because many a times what happens is after 1 week when you do a follow up, and then you see that okay, not no weight has changed, no client is not feeling any change, nothing is happening, even for 2 weeks nothing is happening. So these kind of meal images will actually tell you a lot of things. They will tell you whether they are actually using the right vegetables, actually whether they're putting the right portion size. So like with this just one example, I can tell you this patient or this client was totally had a misconception that corn is a vegetable. So she was having corns as in place of vegetable, which is again a carbohydrate source. So she was majorly having carbohydrate in her meal with no vegetables, and there was this one protein which was curd. So when I told her corn is not a vegetable, then she was literally taken aback. So these kind of pictures you would never know, because I give the freedom to choose their vegetables. I give the freedom to choose their pulses. I give the freedom to choose their protein source. I tell them the basics and then I empower them. I teach them, I empower them, I tell them, okay, now you know this, start doing it. Send me pictures, I'll see if you're doing right. So become a teacher to your patients. My again giveaway point, become a teacher. Teach them. Don't just sit on their heads and tell them, okay, this is what you need to do. They will never do it that way. And weekly weight updates, you know, it is very important, but do not encourage them to check weight daily. You have to teach them change happens gradually, right? Weekly follow-ups is something which I feel really works when it is in a smaller setup. Maybe in a hospital setup, weekly follow-ups don't really work, right? Emphasize and check other parameters. Many people think that it is just the weight on the scale which will, if it is going down, then they're becoming healthy. But that's not what it is, right? There's a lot of other things which are important that they need to understand, which is making them healthy, like their digestion is getting better or not, whether their energy levels are getting better or not, whether their concentration levels are getting better or not. So all these pointers you need to keep in your checklist, so that whenever you do a follow up, you're checking these with your patients, so that you know, okay, if these improvements are happening, they are actually following your diet plan, because these changes or these improvements will only happen when they have followed your diet plan. So it's very critical, guys. Just asking, okay, how are you feeling, have you followed the diet plan, that's not what a follow up is. You have to again gauge, you have to probe, you have to ask questions indirectly to understand whether they're really following what you're doing with them. Celebrate small achievements, very very important. Now this client of mine, she just said, okay, my weight does not reduced, but my old clothes are fitting me. So she did have an inch loss, right? So I celebrated that. I told her, enjoy wearing your old clothes, your weighing scale will show the result, don't worry, that's not critical, that's not important, it's just a matter of time. And believe me, she was so very happy. Celebrate small achievements. We as nutritionists, we as health coaches, we as doctors, we forget doing that. We feel our job is understand the problem, give a prescription, job over. No, in the real world that doesn't happen, that doesn't help, right? Because we are dealing with habits and behaviors, guys. So strategies have to be where we are enabling our patients, we are enabling and motivating our patients, right? Self practice to develop ideas, this really helps me. I practice what I want my patients to do. So like I never used to do early dinners, I did it myself for 1 week, and I really wrote down what really helped me after that, what motivated me, on what barriers I faced that which stopped me from doing it on particular days. Because these kind of practical experiences your patients go through or your clients go through. So if you have done it to yourself, you will have some practical ideas to help them cope up with their problems. So self practice, do that once. Don't be afraid to experiment a little. Please do experiment. Don't stick to just theoretical aspects. You are nutritionists, or you know what is nutrition all about. Your knowledge is way more than your patient or your trust your knowledge. Don't be overconfident, but trust your knowledge. You know what grains can be replaced with what. You know what food can be replaced with what. What if this is not there, what can be done? So use that practical knowledge, use that theoretical knowledge here, and help your patients. If they are not able to digest something, what you can replace it with. Do little experiments. Keep your patients informed. Tell them every time you change a plan, what you change, why you're changing, they feel empowered. And believe me, once they've understood what you're doing with them, they become very self-sufficient in due course of time. I've had my patients and my clients for years with them, guys. And the only reason they don't leave me is because they just feel happy. But they don't really literally want me to write down something for them, okay, what they need to do, because by now, after a year or so, they are so self-equipped. They themselves will tell me, acha ma'am, iski jagah pe, in place of this, can you give me this? Can in place of besan chila, can I have this chila, please? Can I, instead of oats, can I have ragi, please? They will themselves know what they can replace, because I have empowered them, I have taught them, I have taught them. That's very, very critical, guys, right? For your success as a counselor, right? So, essential skills required, guys. Questioning, very, very important. See, when we say, I don't put you on a diet, I help you find foods that are right for you, how do you really practically do it? When you've questioned them very nicely, softly, and empathetically. Never overpower yourself on anybody. At times, we, because of our own emotional we bring our personal emotions when we are literally practicing something or we are into a professional world. Never let that happen. So be smiling, be empathetic to your patients, be empathetic to your clients, understand their problem. Don't tell them, oh, you're just saying for the heck of it, you just don't want to do it. Never let them feel like that. Understand, if you can face challenges, they are also facing challenges. You are there to help them give solution, and not comment them on their problems, right? So questioning is a very critical skill. How to question. And listening, you need to be very, very patiently listening. Once you've questioned them, they will open up and they will tell you something. They will come up with their issues, they will come up with your, if you've really get made that connect, then please be quiet, listen to them. Don't think, oh, now the person has started talking, wasting my time, I've asked what I have to ask, what is the problem? No, you have to let them speak. You have to understand what are their issues. Maybe they will come up with something more which you have not even expected. So be a patient listener. That's when you will identify their true needs, right? Because with questioning, you would get to know what you want to know. But while listening, you would get to know what you won't have even imagined exists, right? And then visioning. With this questioning and listening, you would be able to vision the right intervention. You would be more far sighted. You would know how to empower your clients, your patients, and you would be able to design and structure the right diet plan for them. So, this is very, very critical. So, this is what I had for you all, guys, coming up to a little tiny small case study, how I really practically include all these pointers that I've put across to you, and what really made a difference to one of my very, very good clients. And he's an international client. So, just a quick go through. So, you can see the client's age is 40 and height. This client came to me almost 6, 7 months back. His age is 40, height is this, weight is this. You know, you can easily see the client is almost 10 to 11 kgs overweight. He was recently diagnosed with diabetes, borderline hypertension. He had high triglyceride levels, right? So there's a therapeutic condition here. Client was quite scared, and client was pretty much motivated, and he literally was, okay, just help me here. He came me with that kind of a mindset. Location, he lives in Japan. So obviously there were some barriers. Food preferences, he was a non-vegetarian. North Indian food is what he prefers. Doesn't like milk at all, okay with curd and paneer. So there are certain limitations which I got to know with the little questionnaire or with the little basic things. Now, barriers I identified post probing. Now, if I would have restricted myself with the basic questionnaire, I would have just got to know what I just told you. But this is what I got to know more when I probed him. I got to know that client's knowledge about his medical condition was incomplete. He really actually didn't know what happens in diabetes, because he was constantly telling me, I'm craving, I'm always hungry, I'm always hungry. He didn't really know his hunger was directly related to his insulin resistance. So I had to tell him. And that's where he eased out, right? And he listened to me more. Going to office only on Tuesday, so his schedule was varying, is when I got to know, when I probed him further. Craving for heavy foods or oily foods, especially when stressed out. Weekends is when he really craves for such kind of foods. I would have not got to know this, because he just told me on a simple question, when how many times do you eat out? He told me twice in a week, and I asked him, okay, what kind of food you end up eating? Mughlai and blah blah. But if I only probed him, okay, what kind of foods you like, right? Then I got to know wife is the main support system, is when I probed him. And few Indian foods not readily available in the local area, is what I got to know. When I listened more patiently to the client, is when I got to know client wanted to be pushed. I didn't ask him. He ended up telling me himself that I am a person who will get demotivated easily. So I need a push, especially in the beginning. Client wanted special meals on weekends. That's what he told me. Client was scared of his medical diagnosis and wanted to reverse his condition at the earliest. Thus was needing support. This what he demanded himself. I never knew the person so robust like him would ever want that kind of a support. I thought he's self-sufficient. He knows enough about himself, right? That only I got to know when I spoke to him more. I listened to him more. And then finally, my vision, what I really thought for him. I identified client was intelligent but quite scared due to his recent medical diagnosis. With proper knowledge shared, I could overcome his fear and gain his trust. By customizing his diet plans as per his barriers and needs, which I just shared with you, client was able to adhere to the diet 80 to 90% most of the times. By asking his daily meal picks and number of steps he walked, he was motivated, pushed to stay on track. Like you can see, I've given an example here what he used to do. He used to take a picture of his meals, take a picture of his daily steps that he used to take and send me, and he used to do it every single day. And that pushed him, that motivated him, and that's kind of a support system I gave him. And this was the result that I wanted to show you guys. For a person like him, because he came to me through his sister, and his sister told me he just doesn't listen to anybody. And in the span of 6 months, guys, his HbA1c dropped down from 8 to 6.2. And his weight dropped from 98 to 91. He's 91 right now. In diary, it shows 92.9, but he dropped further. His blood pressure started coming under normal range without medication. His triglyceride is not mentioned here, but his triglycerides came down to normal range. It came down to 180. So, with his dedicated efforts, yes, it is his dedicated efforts, but with a counselor's constant support system, with the right guidance, and I could guide him rightly only when I understood him correctly. So, that is a very, very important thing, guys. And that's what I have for you all. So, I'm open for question and answers, guys. Ritu?
Yes, ma'am.
Yeah. So I'm open for question and answers. So this was my entire session. So first, if anybody has to say something, if you have to say something, was it something that you really get something out of this?
Yes, ma'am. Really, we got a lot of things out of this actually, and everything was unique and like great in its own way. First of all, I would like to thank you for that probing thing. Actually, we have like in practice, many of us have like become like robots and asking the only
Yeah,
said questions, mentioned
yeah,
questions.
yeah,
That was very good, and
yeah.
I personally like the one about customizing diet plan according to different patients
Yes.
differently.
Yes, it is very, very critical, because what happens is when in the practical scenario, people will not see the diet chart. They will see what is feasible for them. They will see what is practically doable for them. And if you've not identified it at the right time in the beginning itself, your diet plan will look like just a written matter for them. It will not be something that they can really relate to and do it. So you have to really make it. So customization means that only, that the diet plan has to be what they can do, not something which you want them to do.
Very true, ma'am. Even one more thing was very good about the session. It was like we are a moderator, mediator, or a channel. We need to
Yes,
empower, not
yes,
impose.
yes.
So that was really very great, actually.
Yeah,
Um,
thank you.
I
So,
first,
students, all you people out there, the others who have heard me, if you have any question, anything, please go ahead and ask.
ma'am, there are even some diet
Hmm,
myths.
hmm,
Some people, some dietitians, they
hmm,
like don't recommend about drinking milk.
hmm,
There is one myth on that, drinking
hmm,
milk. Then over drinking water, like constantly keeping on drinking water, or like going only on diets,
hmm,
having water
hmm.
only. Then even about the timing of eating, what are your preferences, or what do you recommend we
Okay.
should tell patients?
Okay, so again, I will come to the same point. It's individualistic. Now, there are certain general guidelines which are general for everybody, but then it becomes customized when it comes to a particular patient or a particular client. I'll give you an example here. Like you said, all about, I'll part your question. Okay, so I'm talking about myths, I'll talk about later. So I'm giving you answer with what I recommend and what do I give to my clients or patients. So, if my patient is not drinking enough water, definitely I will give them general guidelines. But if I see that the patient or the client cannot drink regular or cannot doesn't even like to have a regular water, then I'll find a reason or I'll find a way of making their her or him drink liquid in some way. So I would rather give them ideas of detox water, like just infused water, not literally detox water, but infused waters I'll give. Or I'll give them, ask them to have more of buttermilk or have more of liquids in soup form or in some form so that their liquid intake is enhanced. Yes, water will be very, very critical. It doesn't give away the fact that water is very critical. But again, it will be a stepwise approach. If they're not able to take 8 glasses in the initial go where they're taking only 3 glasses a day, I won't ask them, okay, start 8 glasses just from tomorrow itself. I'll tell them, okay, right now you're taking 3 glasses, go up to 5 glasses. Do that for 1 week at least. Then once they have said, okay, now actually I'm feeling like having 5 glasses, then I'll tell them, okay, start adding one more glass of water. Right? So your capacity of your client and your patient, you have to identify as a coach. You have to understand how much they can take and then give them and then guide them. You know what is the ultimate RDA or what is the requirement, but don't believe that what you want them to do they can do it from day one. They might take a month to reach where you want them to be, or they might take 2 months, but that step by step progress will actually help them do what you want them to do. So that's what I do, that's how I guide them. So whether it is water intake, whether it is fiber intake, whether it is, so coming to that myth part that you asked me, believe me, there are many fat diets. It's just not this keep you don't, there are diets where you don't have to give milk. There's so many other fat diets there. There are mono diets, there are this, there are that, many diets, right? But as I said, have faith on your knowledge, have trust on your knowledge. You know what is good nutrition. You know that a body will be healthy only when it gets all the nutrients in the right proportion. So, if a diet is saying skip the carbs, if a diet is saying skip this, or just have only high proteins or have only high fats, do you really think A, see whether it is that particular diet is giving complete nutrition, and then see the sustainability? See these two factors. If your diet plan is giving these two factors to your patients, it is a perfect diet, or it is a good diet. I would say perfect diet to kuch nahi hota, but yes, it's a good diet. So you have to analyze whether the diet that you're trying to think and give to your patient or your client, don't go with these. See, as a nutritionist you need to know everything. You even need to know what are these fad diets or myths that are going and circulating all around. You don't have to bust them all the time. You don't have to keep telling your patients, oh, this is wrong, this is wrong, this is wrong. Don't sound negative, but you know what is right, right? So you work the right way, right? By saying that is wrong, you will not become right. But if you are doing the right thing, if you are giving the complete nutrition and you're making the person healthy with the right guidance, you are any which is doing the right thing. So that's what my view is, or my take is. I hope I've answered your question, Ritu.
Yes, ma'am. Very clearly you answered.
Yeah,
Thank you.
welcome. Anybody else has any question? It's just Ritu who had questions. Nobody else? Any random question, anything?
Ma'am, there is a question to like the person has posted to me in the chat box. That
Uh-huh.
Kavita, she is
Okay.
telling, is milk good or bad? Then what should we consider?
Sorry?
About milk, she is asking, is milk
Uh-huh.
good or bad? What should we
Okay.
consider?
Okay, so now you guys are naturopaths also, so please don't literally take take me good or take me wrong. But I feel milk is very very essential. It is one of the important important nutrients that is required by the body. But yes, I can't negate the fact that today, because of adulteration, because of all the hormonal imbalances that women are going through, or overall milk has been adulterated big time. And if your milk is coming from the right source, and if it is coming from a proper farm, it is being, or you have cows which are giving you milk, and you are sure of the authenticity and that's not being adulterated, I don't think there's any harm in having milk. Milk is a very, very rich source of calcium, protein, and which we really need. So it is very, very important that we keep that thing in mind. But yes, in many hormonal conditions, or when I see that milk is really obstructing in the hormonal condition of a woman, I would really try not give milk. Or if somebody is lactose intolerant, which you would agree that in case of allergies, I would really not give. So in those particular scenarios, I would not want somebody to have milk literally. But if it's not adulterated, and if you're getting a fresh farm milk and you're sure about that, I wouldn't literally go off milk unless somebody has issues typical like IBS, somebody is having problems with digesting lactose, or in those particular scenarios I would not want to give. And that's where I again come, it's individualized. I don't generalize that milk is good or milk is bad. Milk is is a nutritious food, and I wouldn't take away just like it. I wouldn't take it away from anybody's diet just for the sake of it. I would identify why whether it is really needed or not, and only then I will decide whether it is good for that particular person or not. So that's my take on that.
Very
So
true.
yeah.
There are few questions in the chat box.
Yeah,
Would
I
you
can
like to
see.
read it?
Yeah, yeah. So can you comment on wrong food combinations? Okay, so wrong food combinations. So it is quite open-ended. It's not a very straight question. So wrong food combinations. Can you just type in what do you literally mean? Just say, just give me one combination and then probably I will understand. And then, oh, you're most welcome, Kavita. So I think it is Shravani who asked me this question, commenting on wrong food combinations. So if you could be a little bit more precise, give me an example of what you're asking, and then I will answer you.
Hi, ma'am. This is Shravani. Can you hear
Yeah,
me?
yeah. Hi, Shravani. Tell me, Shravani. Yeah.
It's like few people are having myths like we must not combine few foods like egg and curd and egg along with few kinds of vegetables.
Yeah, like for
Yeah,
example,
this is
many
my
people
question.
say, yeah, many people say, okay, your spinach and paneer, palak paneer, many people say, okay, don't do that because they say that the iron absorption and calcium inhibits the iron absorption, blah, blah, and vice versa. Okay, so now, yes, in many food combinations, it is true that to a certain extent, these nutrients interplays or interwork, and they do counter effect each other's action. But then you have to identify how much you're giving that food item, because that counteraction not happens in a small quantity. That counteraction happens when you give in large quantities, or somebody is really taking it day in and out. Now if somebody is having a small katori of palak paneer, like 150 grams of palak paneer, how much palak is going in and how much paneer is going in, and you are asking the person not to combine it and not to enjoy that combination, that will not inhibit anything, right? So you have to understand the actual quantity that you're giving in combination as well. If that combination is in large quantities, definitely it's a no. But if it is in small quantities and it's not going to be, then go back and read after how many quantities will they interact and they will do the inhibition. If you are restraining yourself from that particular quantity, combinations will never hurt the client or never hurt. Yes, but like things like when you are having tea with tannins or caffeine with a healthy food, they will immediately do a wrong thing. So your knowledge is where you need to be very careful of. So tannins will immediately inhibit the absorption of iron even in small quantities. So that's where your knowledge is very critical. You should know in what quantities what will inhibit the other nutrient intake or absorption. So that's where you have to remember and then give correct guidance or correct combinations. So that's what I have, that's my take on that. So your knowledge should be very clear and thorough on that, on different combinations and different, so read about it. Just don't, just because somebody has said, okay, I don't eat fish with egg, fish with milk and egg with milk, just don't go by that. Read about it, have a thorough knowledge. What is the reason? How do the nutrients interplay with each other? And if the quantity is very little, and then the interplaying of nutrients is not going to affect that to that a big great extent, take it easy. Don't overpower anybody with that kind of an information. I hope I've answered you, Shamni.
Yes, ma'am. Yes. Thank you, ma'am.
Most welcome. Okay,
One
so
more thing
yeah, go ahead.
regarding to the previous question of lactose intolerance.
Mhm.
Uh, is it possible to develop all of a sudden at any age group this lactose intolerance, ma'am?
If I go with my experience, I have seen people developing lactose intolerance. Many children or many people are born with it, right? But many do develop. There are a lot of, especially when you are getting older in age, your digestion goes very poor and you are intolerant. So there's a difference between really being allergic towards lactose and being intolerant towards lactose. So intolerance can develop with age, but literally allergy doesn't happen anytime. Allergy will be from the beginning. You would be allergic to it or you won't be allergic to it, right? But yes, your intolerance can happen. It can happen at any point of time for any XYZ reason.
Okay, ma'am. It was clear. Thank you.
Welcome. Most welcome. Okay, then there is Apurva. Please suggest some books on nutrition which you use, and thank you for the session. You're most welcome, dear. So, I really, in my college years, which is like almost I don't know how many years back, I used to read Cross and Mahan. So this is a therapeutic book on therapeutic nutrition. I really read on that, and other books I really read like more or less for my latest information. I read latest researches, not literally books, but yes, I have this book on science of nutrition from my professor from England. So she had wrote this book, and it's a very beautiful book, Nutrition of Science, by this author called Janet Thompson. She was my professor. So that book is also very critical. And then I really love to read whatever I come across is very interesting to my eye, something which I really want to learn about. Like I have these books on obesity, I have these books on pregnancies, these small little notes on pregnancies. So little things which I would really want to know what's happening around the world. And I would rather read some even international author books as well. Like I have this book on 8 steps to reverse PCOS. So that is a very beautiful book. If somebody is really into hormonal balancing, because I'm a hormone specialist, so I really got to learn a lot, like something which we as here in India, we really don't look into those aspects. So those kind of books which I read, and you guys should. Name of the books. Okay, so Janvi book, one is Cross and Mahan, book by Cross and Mahan. So Therapeutic Nutrition is the name. Therapeutic Nutrition by Cross and Mahan. It is K as a cross, not C. So Kraus, Cross and Mahan. It's a very, very technical book on therapeutic nutrition. So you'll get to learn a lot of medical nutrition therapy, right? So very typical, like in this medical condition, this is what you need to do, this, right? And so that was really my Bible when I was doing my studies, my dietetics and all that. Then if you want, I can just give you the names. I don't remember typically. So this is one book. You can just write the name. Author I'm forgetting for PCOS. It is 8 steps to reversal of PCOS. 8 steps to reversal of PCOS. A care book, which is Decoding Obesity. It's a really good book. I mean, something which is very practical aspects. And at the end of it, guys, it's not that a book will tell you what you really need to do. Okay, it's your practical experience which will tell you, okay, where to use what kind of knowledge. So you have to become that ocean of knowledge, and you should be identifying, okay, what knowledge to use where. So if you are able to do that, you will be the best coach or best dietitian out there, or best nutritionist out there. Because if you are just randomly putting your knowledge just for the sake of it, ki, okay, this is what you need to do and this is what you need to do, you will always end up being a disaster. That's my take. Okay, so that's that. Okay, you're welcome. Any other question? Eating 3 meals is better, frequent meals. Okay, in diabetes, so Lakshmi Kant is who has asked me this. Thank you for the question. So eating frequent meals is what I propagate. Now, 3 meals, why would I really stick to that 3 meals? Because I know with experience and with science, short and frequent meals is something which sensitizes insulin action. So I really need to, for the patient to understand that. Why does insulin resistance happens in the first go? Because people do not realize the portion size of the meal that they're eating. And when they eat big meals, after a long gap, they will end up eating big meals. They will not have smaller meals when they have a long gap. And they will eat more, and large portion sizes will further increase their insulin resistance. So I do stick to small and frequent meals, but then I identify and explain what does that mean. That just doesn't mean every 2 hours you're eating something, right? So my minor meals will be something that you drink. You just break that gap by just having maybe some nuts in between, or maybe you will have something to drink, something which is healthy, like you would have some buttermilk in between if the client is okay to have, or some any other drink which they would want to have, or just have a cup of curd or something which is giving them nutrition also, and which is breaking their long gap, and they're sensitizing them for the insulin. So there's no surge of sugar release when they're eating larger meals, and the requirement of insulin is not high at a particular go. I hope I was pretty clear with that answer. I have not confused you. Lakshmikant, was I clear?
Yes, thank you, ma'am.
You're most welcome. You're most welcome. So I think I've answered most of the questions which I can see here. Janvi, thank you so much for your compliment. Anybody else has any other question, or I think we can wrap up? Ritu, do you have any other question, dear?
Ma'am, this is Lakshmi Kant.
Yeah,
One more
Lakshmi.
question I have.
Yes,
Yeah,
please.
can you please take some information on being vegan, like, because that's one of the like
In
many
things.
people are trying to follow, enthusiast about vegan, which is widely followed in India but
Yes.
yet, yeah,
Yes.
continue.
No. Vegan is not only very widely followed in India, you're mistaken. Vegan is literally
No,
out
which I
there,
mean, yeah,
global.
out there,
Yeah.
but
Yeah.
which I mean, like
Hmm.
India had a lot of propaganda initial days,
Yes.
but now
Yes.
people are changing it. Yes.
Okay, so let me come to our basics here, Lakshmikant. Getting back to our old roots, okay? So I'm one person who is not ever propagating what is the in thing, okay? So I will never be like, oh, just for the sake of it, because it's so in thing, I will say somebody, okay, become a vegan. Why would I divide somebody from if they love non-vegetarian food or they love milk and milk products? Why would I want that person not to have that just for the sake of being vegan? Just because it's the in factor? No. Again, it comes down to the factor, does that person really needs it? So if a person is not doing okay, having hormonal issues, if a person is not tolerating milk and milk products, or the person is having endometriosis, or a person is this typical medical conditions where I would want a person to get vegan, I would not get into a vegan diet just for the propaganda, just for sounding that I am the in nutritionist. I would never ever do that. I don't do it. So my take is, okay, vegan diet is, again, same comes for the keto diet as well. Nobody has asked me about that. I was thinking somebody will, but remember, every diet that comes out for a reason. Okay, there is some scientific base, or there is some scientific reason for which a particular diet has been made. Always connect to that reason. Now, keto diets were made for people, for the children who have epilepsy. We have forgotten that, and we have literally taken that diet for weight loss, simple weight loss. Why? Why? And believe me, researchers have said that, okay, keto diets have helped in bringing blood sugars down, but at the cost of what? At the cost of expenses, at the cost of person's sustainability towards a diet, at the cost of patients person's mental state. Because with less of carbohydrates or no carbohydrates, you know what are the side effects a person would go through. The person will not feel up to the mark, the person will feel dizzy. Okay, I've digressed from vegan to keto, but that's what I relate with vegan also. Now, that would not literally give you some kind of a side effect, but why would I want somebody to go off milk and milk products, go off non-vegetarian sources, if somebody can have simply eggs and get good protein? I'm limiting the person's protein intake to just soybean. And what if a person is having thyroid condition? I've totally made the person go obsolete on protein sources. So again, my same point comes in, Lakshmikant, or all of you here. Please, before you give a diet, remember who is sitting in front of you. Remember what is the need of the person. Remember, identify what are the person's barriers and needs. If you are not going to identify, and just for the sake of your own propaganda or some thoughts, you've given some kind of a diet just to make it fancy, don't do that. You will fail big time, because your patients will not adhere to it. They will not follow it. And whenever you make a diet plan and you give it to them, first discuss with them. Tell them what you're wanting and what you're thinking. Why are you wanting them to give? Sometimes we feel, oh, doctors just write the prescription. Nah, they don't discuss with the people, or don't discuss with the patients. I'm giving this medicine. You're okay having it, na? That's a different case, a different scenario. Here, you are asking them to change something in their daily routine. They're not going to have that diet for 1 day, 2 day, or 1 week. They're going to have that diet. They're going to gradually change their habits. They're going to actually change their behaviors. Food is something related to their daily, it's literally connected to their system, their behaviors, right? So you cannot do something just for the sake of it, for just being fancy, ki just, oh, this is something very different. Believe me, simple dal, roti, sabzi, basic diet, basic food. What love and the kind of adherence you will get with those kind of diets, and the kind of love you would get from your patients or clients. They will be like, so many people, so many patients of mine, they come and tell me, ma'am, I thought diet was something very different. I thought that dieting means this, dieting means that. I have to stop this, I have to stop that. And I just laugh. I just smile. I tell them dieting is not that you have to starve. Dieting is that you eat good food, you eat complete nutrition, and you sustain your body, you become more nutritious. That's dieting. There is such a big wrong notion of dieting, and by giving these kind of diets where they're devoid of certain nutrients, we are further propagating the aspect, okay, dieting means we have to cut off something from our diet. I hope I've answered you, Lakshmikant. I hope I made sense to you.
Yes, ma'am. Yes.
Yeah, you might not relate. That's my perspective, and that's my years of experience. That, believe me, by these fancy diets, they are not sustainable. They are not, until unless there is a medical condition for which it is essential for that particular diet to be followed. That's separate. Like in celiac disease, you have to give gluten free diet. But for a normal person who wants to lose weight, you cannot make the person go on a gluten-free diet forever, yeah. Right? So you can do these hidden trials in between. As I said, you experiment. Okay, you do these little experiments, but never put this into your client's head. This is something that you do for the rest of your life. Tell them, begin with small steps, small changes. Never go give these intermittent fasting diets or these fancy international diets on the first go. You will fail. That's a sure shot thing from me. You will fail. Always go with what they're doing, small little changes. Bring them to something which is sustainable, normal diet. You will see most of your clients and patients on the first go, they're not even eating normal food. They're not even eating healthy food. First, make them do that. And then do whatever needs to be done later, those little experiments that you want to do to make them achieve what they want to. Right?
Very true, ma'am. A very great takeaway message you gave us. Thank you so much for the session, and thank you so much to the listeners too for the patient listening. We'll surely want you to join us again and like teach us more and more. We truly loved your ideology, and thank you so much.
Oh, thank you so much, Ritu. It was really a pleasure. If my takeaways, my learnings can help you guys out there, because I am sure most of you will end up becoming nutritionists. I have naturopath friends, believe me, from Bangalore, because I'm sure you guys know about Healthify Me. It's a company in Bangalore, and I have worked in Healthify Me for a long number of years, and that was my online platform that I went to. So I have so many naturopaths there who have become a nutritionist now, and they're working as nutritionists. So you might end up doing all that. So if my learnings and my little experiences can help you practically practice nutrition better, I think I've done the job then. Yeah.
Thank you, ma'am.
All right. Okay. Take care. And yeah, somebody asked for contact details. So I will just share my screen once again, and you guys can see my contact details. That's there. So if anybody wants, that's my contact details. All right, Ritu, thank you so much. And you guys, all you young guys out there, all the very best. And keep working hard, keep gaining as much knowledge as you can, and learning never stops. Remember, even when you get out into that practical world, every day, every patient will make you learn something. So be open, very, very open. The more you are open, the more you will learn. Never think or never keep it in mind, oh, now I have 5 years of experience, now I know everything. Oh, now this is the way I know, this is how it works, so this is only how it works. It never happens like that. It is you evolve. So if you're open to evolving, you will go great heights. Okay, guys, thank you so much. Bye. Thank you.